I remember these days as if it was yesterday. The meeting with the twin sisters with the problem of psychomotor disability, then the fantastic collaboration of the parents throughout the whole investigation, in fact, then my finding of an abnormal combination of biochemical features in the blood, and then a period of reflection about what could that mean, what was the meaning of all this, and then finally a great breakthrough in '84 when we found that there was an abnormal transfer in isoelectric focusing, which is still the test, I would say, the most important test for the diagnosis of CDG. Yes, it was a big challenge, absolutely right. Because from the beginning I suspected a fundamental problem behind these clinical and biochemical findings, and therefore I was determined to find out what was the basic problem. And fortunately I found on my way very good collaborators, in fact, mainly Emile van Schaftingen, a biochemist working at our sister university, UCL, Université Catholique de Louvain, and on the other hand, the geneticist Gert Matthijs, working in our genetic center in Leuven. Even before the discovery of the basic defect, I informed the scientific community with lectures and conferences about the findings in this new syndrome. It was a new syndrome, although at that time we did not yet know the basic defect, but it was a new syndrome characterized on the one hand by morphological abnormalities, particularly inverted nipples and fat pads, very unusual association, and on the other hand a combination, an unusual combination of biochemical features in the blood. But the future will be characterized by the exponential increase of genetic techniques and genetic diagnosis, because genetics is really a revolution nowadays, and this is also true for CDG. And I foresee that a number of CDG will be found due to epigenetic defects. That means in the mechanism that switches on and switches off genes. And regarding treatment, that will remain a formidable challenge. But I am optimistic, I must say, and I am quite sure that techniques such as CRISPR-Cas technique and other genetic techniques will be very important in the further treatment of these patients. I hope so.